But exercise intolerance is also extraordinarily common in fibromyalgia and thyroid disease. Why? Think about it. As we said earlier, fibromyalgia is a disorder of metabolism, meaning our bodies become very, very inefficient at producing energy. So the more we can do to facilitate energy production, the better we're going to feel. This is why exercise does help with these symptoms. One of the keys to the diagnosis oftentimes of both thyroid disease and fibromyalgia is exercise intolerance. That exercise intolerance is oftentimes secondary, if not alone, or not due just to thyroid dysfunction alone, could be secondary to the underlying dietary deficiencies like magnesium. And the bottom line is that when patients are administered magnesium orally or intravenously, not only do they feel better, but their exercise capacity comes up. Why am I making this point so strongly? The fact of the matter is that we know that when patients with fibromyalgia treat with magnesium and lifestyle modification long term, they're oftentimes able to eliminate or significantly reduce the medication, which can have significant side effects. We're talking about the antidepressant, the SSRI type medications in particular. There's also, in my opinion, no good evidence at this particular point in time that patients should submit themselves to long-term usage of any of those medications or even some of the other drugs that are commonly prescribed for patients with neuropathy and chronic pain without trying all of these things first. Drugs have a place, yes, that's for sure, there's no denying that, but all these other things should be tried as well. A couple other things that are certainly well worth trying if you suffer from fibromyalgia and indeed many forms of chronic pain. Let's talk about some of the therapies that we know can help your body produce energy more efficiently. One, of course, would be an old standard, if you will, and by old we're going back at least 30, 40 years, and that would be an electrocurrent called microcurrent. We do know and have known for many years that microcurrent is a form of electrotherapy that helps our bodies produce energy. In fact, some studies have shown that we can increase the production of ATP, which is the powerhouse of the cell, by as much as 500% by treating a patient with microcurrent. We also now know that certain forms of phototherapy, or photomedicine as it's called, laser in particular, at certain wavelengths and frequencies, and the same with LED, light emitting diode therapy, is also capable of helping to produce more energy efficiency, especially in local cells, and may have some significant bearing on disorders like fibromyalgia and neuropathy, simply because they help us become more efficient at producing energy.